pulse was very low today, so the nurse called me this morning.
Dr. Mary Morris is a trailblazer. Dr. Morris is the first to take part in the Geriatrics Fellowship Program, the only program of its kind in South Dakota. For Dr. Morris, who spent 15 years as a family practice physician, caring for the elderly is personal.
I'm very comfortable talking with older people. My family was older, my parents were older, and so we always interacted a lot with older people. I enjoy visiting with them and getting their story and their history behind that.
Dr. Morris is the first of what we hope will be a long series of classes of fellowship people, graduates from our program. So hopefully we'll turn out geriatricians for South Dakota for a long time. We are accredited for teaching 2 fellows for 1 year. And fellows have already taken a residency. In geriatrics, it can be a family medicine residency or an internal medicine residency.
While Dr. Morris is only 3 weeks into her fellowship, she's combining what she learned as a family doctor with new techniques she's learning from Dr. Sandvik and others.
In visiting with the elderly patient, I've worked a lot on that approach over my years in practice. And I've also been working on hospice and palliative care, which gave me a lot of good techniques on interacting with people and getting their full story, which is very, very important in geriatrics. They don't like to burden people with some of their stuff. And so it's a matter of asking things in different ways, repetition, and then just giving them time to talk. They often have to think about their answer more. They're not as willing to just jump in with things, and just giving them the time they need to answer your questions.
Dr. David Sandvik, a geriatrician and medical director at the Good Samaritan Society in New Underwood, South Dakota, says understanding many different types of health care is required to treat the elderly effectively.
Geriatrics is absolutely a team sport. We can't do it without a lot of other disciplines, and that's one of the core features of geriatrics and taking care of older people. Dr. Morris has been reading and going, oh, I didn't know this about older people and older people, medicine and older people. Why doesn't everybody know this? By training people in geriatrics and having them see how geriatrics actually works, I think we can get some of that knowledge out.
The baby boomers turned 65 this year. So it's the start of that baby boom era, and we know that they are the movers and shakers. They're the people that want things the way they want them and they want to get it done. These people very much are going to change our geriatric care in the years to come, and they very much want to stay as independent as functioning as possible, which is what geriatrics is all about.